So yeah, brilliant to have you all here. I'm Dawn from Street Games, and I'm just doing the introductions this morning just to get us all going. So fantastic to have you here. We've got loads of people jumping in now, which is fantastic. So excellent lineup this morning. And good news for all of you is I'm doing very little this morning apart from handing us over to the chair for our session. So welcome along and welcome to today's, it's one of the final sessions actually for the Street Games Conference this year. But for me, we're really bowing out on a high because we've got some amazing speakers for you. And my only job this morning is to introduce our chair, who is Professor Joan Duda from the University of Birmingham. Quite an illustrious career in the field of motivational and climate, kind of based around motivation and helping everyone from grassroots to elite athletes continue to perform at their highest level, and also the founder of Empowering Coaching. So a fantastic chair to kick us off this morning. And Joan, I'm just going to hand it over to you. Thank you.
All right. So yeah, welcome everybody. We may be last, but we're not least, particularly in terms of the topic today, which is a very, very important one. It always has been, but I think especially living through this last 16, 18 months with the pandemic, and thinking of the mental health of young people even more pertinent for all of us. So the topic is looking at mental fitness and whether it's prevention or cure. I've already renamed after looking at the content of what is going to be shared by my good colleagues that are part of this session. I've renamed our session to Prevention and Cure, because I think the various interventions and lines of work that we'll be talking about will certainly point to how we can use sport to do both when we speak about mental health outcomes in young people. So I'm joined by three illustrious gentlemen here. We'll have Graeme Law, Dr. Graeme Law from York St. John University, who will be talking about their evaluation of the 21x21 campaign, a very interesting project. And then our good friend, Professor Andy Smith from Edge Hill University, will be speaking about, probably in the time he has, only a glimpse of all the work that they've done on sport and mental health for children and the Tackling the Blues project. And finally, and again here, not last but not least, Craig Robson from who's a public health practitioner from Durham County Council, and his the approach that they're adopting that's much more holistic to try to get people on board within the sports setting to promote health and well-being. So in a snapshot, let me just give you a feeling for the line of work that we've been doing. And primarily, I would say to date, most of it has been on that prevention side, tackling these questions in two ways. One is what we can do within the sports setting to promote well-being, as well as what we can do and need to do to prevent compromised mental health in sport. And I'll talk a little bit more about that. And we try to do that with a motivational lens, and have over the years developed and continue to extend training programs that try to promote kind of adaptive motivational environments in sport. So we're speaking about the power, the potential, the promise of sport. If you look at government policies, if you Google on the website, there's just so much about what we look to sports towards, that it can enhance the lives of young people, right? It can promote their psychosocial development. And in terms of this particular session, that it can play a really important part in facilitating their well-being and their mental health. However, both from a research standpoint and an applied practical standpoint, we know that it's not always a done deal. Sport engagement is not always a pretty picture. And what I'm trying to say here is that it's not always that the sport automatically translates into positive outcomes, positive mental health indicators. It depends on how sport is delivered and how it's experienced, right? And particularly, we're talking here from a motivational perspective, what is going on? That helps us to predict. So actually, if we muck it up and the motivational dynamics are less than adaptive, the climates created by coaches, for example, are less than adaptive, sport engagement can actually have negative effects and lead to ill-being in the young people that we're working with, which is the antithesis, right, of what we want. So just a few words about motivation. I guess, I'm a motivational psychologist. That's the primary construct I work with. And there's no question that motivational differences in our young people when they're participating in sport, when they're participating in physical activity, is a major predictor of these differential outcomes. And what the first thing we need to look at is the nature or the quality of that motivation. And at the very least, we talk about distinction between autonomous motivation and controlled motivation. Are our young people in there for autonomous reasons? The quintessential intrinsic motivation, they love footy, they just can't wait to play, it's so much fun, as well as just wanting to be there, that it's an activity they value personally. They're volitional, they're engaging it because they want to. That's autonomous motivation. But you also can have controlled motivation. And those are the cases where young people are engaging in sport because they feel they have to. It's required of them, and or for some extrinsic reward or something of that nature, not the sport itself. So they're a little bit like puppets on a string, and either psychologically or behaviorally in the way they're engaged. So what do we know? From lots of research is we got to do everything we can to facilitate and sustain autonomous motivation, because that's going to help us in terms of these positive mental health outcomes. Oops. And then where does this feed into all those significant others in the sports setting, such as coaches and parents and league administrators and so on and so forth, club administrators that surround young people, is with the way they act, their exchanges, how they indicate their preferences, how they provide feedback, all the type of interactions creates what we call is a motivational climate. It's kind of like a motivational weather system that surrounds young people when they're engaging in sport and physical activity. And this, we know, is a major predictor then of whether they're more likely to be autonomous or controlled in their motivation, and then the experiences of well-being and or ill-being in or via sport. So, sometimes I look at the sector, I look in the in terms of what is being discussed out there, and we talk about having athlete-centered environments, and we talk about having positive environments. Well, I think what's really great news is we can dig much deeper into that. We have a real good idea of what are the key ingredients, what are the active ingredients in what makes an environment adaptive from a motivational health standpoint. And I conceptualize that with the term, when an environment is empowering, right? It's empowering to young people. And there's certain type of features. It's more task involving. I mean, it's mastery focused. There's an emphasis on trying to do the best you can at that moment. It's very autonomy supportive in terms of voice and choice for young people. And it's certainly a safe, caring, and socially supportive environment. And there's a lot of different strategies that help us make this empowering climate. But those are some of the key features. As well, they're not necessarily just opposites. Coaches, parents, so on, can be disempowering, sometimes even unintentionally. It's not just the screaming maniacal behavior on the sidelines, all right? But a disempowering climate, we know, again, what are some of the key features? It's more what's called ego involving, that there's always a focus on demonstrating superiority. It's more controlling. It's my way or the highway, kind of didactic in terms of what we're asking of the young people. And it's just not there with even the symbolic embrace as a safe place. It's more cold and uncaring. All right. And there's, again, certain type of strategies and everything that are better behaviors, but we know what we're talking about in terms of what starts to constitute a maladaptive environment. And why am I making these statements? Well, again, there's been a lot of work done. And sometimes these works use validated questionnaires so we can assess the motivational climates that are operating in sports settings and physical activity environments. We also can observe coaches, parents, and teachers, and so on, and look at how empowering and or disempowering they are. And two, we have rich qualitative literature where we talk to folks and we get an idea of what kind of environments are they in. That's the coaches themselves and the young people, the teachers, etc. What kind of environments are they in, and how do they feel? How do they behave within those environments? What's the case for their mental health? So we've done a number of projects over the years. This is one that I think we're quite well known for. That's the PAPA project. This was a grassroots sport. It involved ourselves and 4 other countries. France, Greece, Spain, and Norway took place in footy. We're all getting ready for tomorrow night. Footy is on our mind, and very much looked at the implications of empowering and disempowering climates in youth football. For mental health, always we have indicators, positive and negative, of mental health in our work. It's always embedded in there. Performance is secondary if mental health is compromised in our view. So we've done projects such as this in community, all the way up to more elite levels, in education, PE, and so on. But let me just summarize very quickly. What the results are amazingly consistent. And that's why we can, I'm saying with some passion in my voice, that if we can have environments be more consistently empowering, we do get that autonomous motivation. And when that autonomous motivation is strong and vibrant, then we're more likely to see the positive mental health outcomes, such as self-esteem, feelings of vitality, and really enjoying and engaging in what young people are doing. However, if we start to have disempowering type of behaviors and strategies prevailing, we're more likely to see, maybe that's not how they entered the sports system or the program, but eventually it's going to lead to more controlled motivation, and maybe even eventually what's called amotivate, where they're just saying, I don't even know why I'm doing this anymore. Get me out of here. And that type of motivational dynamic is a strong predictor of what we would say are negative mental health outcomes, such as anxiety, depression, perfectionism, and so on. And again, a rich literature on these things. So promoting young people's mental health and preventing ill-being in and via sport, what we're talking about is we need positive and sustained climate change, right? This is what we've got to focus on. This is what we need to get to. And that's where the work on empowering coaching comes in. It's a program that's evolved almost 25, 30 years of research and working with the sector and back and forth in terms of, let's take care of this. It's an important part of the story. What can we do to create environments that are more empowering, more health conducive, more mental health promotive? So very quickly, again, a number of projects we've done, but one of them that we really are proud of involved our good colleagues in StreetGames. It was the Empowering Coaching for Doorstep Sport project. I'll run through this very quickly before wrapping up. Within this project, we were able to train 88 of their coaches and volunteers who deliver those doorstep sport programs. They were working with almost 2,500 young people per week. And these were projects that spotted 11 organizations around the UK. And as you can see, we had almost 900 young people involved in the project from England and Wales. There's some of the statistics on the young people that were participating and their coaches, volunteers. So we trained them up in terms of empowering coaching. And even before that, we made a bespoke, tailored version of empowering coaching for doorstep sport, and really worked very hard with our colleagues in StreetGames to have that be something that's relevant to the training academy within StreetGames. So just very quickly, I'm going to summarize the findings. Pop me off an email or message. I'm happy to send you. There's much more detail about what we have found. We've done also a case study in terms of looking at the impact of empowering coaching within the doorstep sport program. But bottom line, in terms of results, very consistent, guys. So, doorstep sport, we're going into communities, economic disadvantaged communities where there's a lot of challenges in terms of mental and physical health. We see the same type of findings, results, patterns. When we were able to have these leaders, coaches be more empowering, the autonomous motivation was higher, The well-being levels were greater. There was enhanced engagement, more resilience, and less aggressive behavior. When the environment was more disempowering, you had more controlled motivation, you had decreased emotional control, you had a number of negative outcomes like more antisocial behavior and so on. It was going pear-shaped. The things were not going in what we were intending to do with these great programs like doorstep sport. And what we do in our studies is when we can, we actually try to contrast the young people and the coaches that have been able to be trained up with those that is not the case, all right? So what I have here is just an example. This is now looking before and after the training. And here we're measuring how the young people's views about how empowering the climate is. It's created by the coaches or volunteers. And, you know, I'm just showing in terms of mean average, you see the difference. We were able to up the ante in terms of the coaches and volunteers that were trained. In terms of those that were not, it was very interesting. After a 4 or 5 month period, actually the empowering features of the environment started to decrease, which could be problematic. My colleagues on this project were Dr. Juliette Stebbings, who's now down at Portsmouth, and Dr. Paul Appleton, who's with us here at Birmingham. And then we also then look at various outcomes. So we measure motivation, we measure a bunch of different things, but here I'm putting up our indicator. We're looking at well-being, and as you can see, the environment started to become more positive with the training, and the well-being of the people, of the young people engaged in these doorstep activities was enhanced, in contrast to what was the case when the coaches and volunteers were not trained. So potential of sport for this concept of mental fitness. I guess my bottom line is, yeah, there's great potential. If we can make sure we can do what we can to create more empowering and less disempowering motivational climates. If we can, we're more likely to prevent mental health challenges, such as our young people experience even greater depression, anxiety. We're more likely to promote optimal functioning, like feelings of vitality, self-worth, and so on. And just a caveat there, these are not opposites. Just because you decrease depression does not mean that you enhance our young people thriving. Just because they survive doesn't mean they thrive. And I don't have time today to talk about it, but I'll just mention very quickly about this cure aspect. And I guess I'd say, you know, being adaptive, health-conducive sport environments, motivationally empowering climates and environments in sport, in which we deliver these mental health interventions, I think we just even capitalize further and make it more likely that these interventions will have a greater effect and also be sustained. In terms of our work, one of my colleagues, Dr. Hannah Balmer, has started to look at these type of relationships between the climate, sports delivered motivation, and health outcomes in the secure state. And also we're trying to do this, we're collaborating with our colleagues at Alliance of Sport with the Leveling the Playing Field project, and that's particularly in terms of what's happening at the tier 3 level. So I'll stop there. Now this is where you get the juggling act going. So I guess I'd close my screen. And so what we're going to try to do is, if there's time for a question or so in regard to each presentation, and I'm hoping we have time at the end to really talk about this, because it is so important. So I know that Emily and Dawn were watching the chat.
Yeah, there's a couple of comments. So Chris has put a comment just to say that it strikes him that reflection and feedback are important for coaches and session leaders in the context that you're talking about, which makes sense, I guess, Joan. And a question just asking whether this work's impacted and influenced NGBs. I know we were talking just at the beginning of the session that you do work from grassroots right through to elite. Yeah. Have you seen any of this work being adopted by NGBs?
Well, the most recent, and I love the way they went about it, actually, is Archery GB. They learned about this work, and what we did is to first start with kind of a needs analysis at the participation and performance levels in archery. What is happening? What's the motivation? Because we also have a methodology which we can assess these things in a valid way. So we were able to look, and they're very interested to know, what is the case? What is the motivational health? That's the term I like to use, of archery at these two levels. And so we did that with focus groups, but also online survey. We took that information. We offered the empowering coaching workshop a few times to everyone, to their management, to some performance coaches, to some participation coaches. We got feedback. And now we have a tailored version of empowering coaching for archery. They wanted to have their own version, and have trained up, I think it's 8 of their tutors to deliver it. So that's off and running. Like it's probably the case for everyone here. It was delayed a bit with COVID. We had to go online much sooner than we were ready to go online, but it is now online, and hopefully too we can get back and delivering some aspects of the training, including on the pitches with in person. But yes, we've done that, and absolutely, is that feedback and for the coaches themselves and reflection.
Chris, do you want to jump in on that?
Yeah, that was work. Hi, yeah, really interesting work. Yes, I was thinking particularly of the coaches and perhaps the people who manage the coaches, maybe the sport development people that kind of work at the next level, encouraging the coaches to reflect and to get feedback on their practice and then make appropriate changes.
Yeah, great points. I mean, just going back to archery, that's what I really liked about their approach, that they wanted the managers and administrators trained up as well. So they have this understanding, and I think the aim is that it permeates the whole system. Which makes a heck of a lot of sense. But the self-reflection aspect, I mean, that's why we really go into the nitty-gritty about these environments and what constitutes them and so on and so forth. So that coaches for themselves can kind of keep a handle on what they're doing, and I made that point that disempowering behaviors are sometimes unintentional.
Absolutely.
And it's just some subtle things that we do, and our heart's in the right place and our intentions are great, yet the impact on young people can be detrimental, if not now, in the long term. So I guess what I like or endorse in this type of approach is that there is a nice conceptual and based on reality lens to help coaches self-reflect. Because it's always, we tell them to do that, but self-reflect on what? And that's the type of thing. And then, I mean, just also when it's possible, not always, but when it is possible, we use the observational system. Sometimes you could do that at the higher academy level or in the schools or whatever. So we go and we record, we do the training, and then we allow, set the stage for the coaches or the teachers to self-reflect after they've come through the, an understanding of the concepts.
My other thought, Dawn, if I may, in raising the NGB question was whether you see this program, the results, the learning, influencing NGB coach education programs at all. Is that part of the thinking? Yeah,
I mean, it's interesting, Chris, because I don't think we move necessarily so quickly in terms of improving coach education. I've been at this for a long time, and my passion is still there 100%. But I believe in evidence-based basis for coach education and the content. And you follow on Twitter and so on, you often hear this, well, we need more research and we need this and we need that. Darn it, we have a lot of research out there.
Well, this will be my final comment. Just going to the very top level, in terms of Sport England, UK coaching, and I believe UK coaching have just launched a consultation on their new strategy for coaching. I got an invite to that actually recently because I'm connected to the Sport for Development Coalition. But it just strikes me that there may be an opportunity there at the kind of policy and strategy level to embed some of this thinking and some of this learning into international policy. Any thoughts on that?
I've been fighting, going along that journey for many years. I hope we can do it. I think sometimes there's in the sector, there's a desire to reinvent the wheel.
Yeah.
And there's also like, we need to do it and not take from, and I just would say, I mean, given the topic we're talking about today, it's so important because whenever I'm thinking about the work we do, I see the young people. I see again when they smile and they're engaged, and I also see when they're suffering. And and we have, and certainly the colleagues that are going to be sharing after me, we have some tools and again research-based programs that we know work, that have been tested rigorously. Get them out there. There's still more things to do.
Well, just final suggestion.
These
I'm just going
blocks.
to comment in from Lisa as well, which I think is quite pertinent, is that actually this could be really useful for parents as well, to bring parents into that conversation and help them understand.
Absolutely.
I think that's a really good point from Lisa there as well. Thank you, Joan.
Yeah, cheers. I totally agree. When you talk to coaches about the major barrier to being more empowering, one of the first barriers they say are the parents. so everyone's on the same page. Okay, we'll turn it over then to my good colleague from York St. John University, who's Dr. Graeme Law. He's a senior lecturer there, and he's also a busy guy. He's associate head of the school. His research has examined the relationships within the working lives of professional sports people, which I think he is one of those, previously retired from being a professional sports man and a coach for 15 years. But basically his work focuses on well-being of coaches and athletes, and he's leading the Tackling Welfare in Sport Together research group. So Graeme, the screen is yours. We look forward to hearing about your work.
Thank you, Joan. Morning, everyone. I'll just try and share my screen. Hopefully that goes smoothly. Okay, can everybody see that?
Yeah.
Perfect. Okay, so yeah, just a little bit of context about me. As Joan says, my background is in professional sport, both playing and coaching. And as Joan alluded to, I think the welfare of people within that environment, as not just the elite level, but also grassroots, is really, really important, because if we don't have that positive welfare and well-being, the dropout rate can be huge, and it can certainly impact on performance and the participation, which is really a shame, because it can be such a positive environment. So what I'm going to focus on today is talking about an evaluation of the 21 by 21 campaign, which I'm sure many of you are aware of. I will offer a little bit of context on that as we're going through. This was conducted by myself, two postgraduate researchers, which were Sarah Ward and Luke Clayton, and Professor Andrew Hill, all part of York St. John University. So the 21 by 21 campaign, it's a campaign bringing together sports, mental health, local government and higher education organisations in a pledge to provide 21,000 community sports coaches and volunteers with mental health awareness training by 2021. It is based on a growing body of evidence that connects participation in sport with the prevention and treatment of mild to moderate mental health conditions. It's based on existing work of organisations that sought to increase mental health literacy among coaches and volunteers. And this campaign was coordinated by a coalition of 11 partners, as we can see there. And it really allowed people to get, push through their passion and improve the environment that some of these coaches are working with and support them. So I'm going to give a brief context again about what mental health training is. I'm sure we're all aware, but just in case those aren't. So it's created to educate and aid the general public in providing initial help with mental health. It's offered by a range of organisations and can be adapted to a variety of different contexts, depending on what environment people are working within. This type of training improves mental health literacy via interactive workshops, videos and resources that are delivered in a flexible way to suit the participants. And a number of studies have found that mental health training can improve mental health literacy. The aims of our research were to discover what are sports coaches' perceptions of their role in supporting participants' mental health, And does mental health training impact those who partake? And if so, in what ways? I'm also going to present the number of coaches and volunteers who completed the training and some of the features of the training, as well as some of the recommendations that came through from the research itself. For the study, we collected data from 35 participants, which was done through semi-structured interviews, just a snapshot of some of those that we interviewed. So hopefully it demonstrates the good variety of age, geographical location, the type of sports that they're involved in, their employment status, as well as what mental health first aid awareness training they undertook, and if they were just there as a coach or if they also undertook the instructor training as well. We were hoping for a larger participant base, both for the qualitative stuff and to undertake some quantitative stuff, but unfortunately COVID got in the way of that. But we're still really pleased to get the perception views of 35 participants. These were stakeholders within the 21 by 21 project, as well as training providers and coaches who had undertaken training. So some of the quantitative data that we did get before going on to the experience of the coaches. So the training was delivered using a mix of face-to-face, online and e-learning modes. The e-learning became much more prominent due to COVID. So I think everything obviously got shifted online. The duration of the training varied from 90 minutes to 180 minutes. The majority of training was free, but some carried an individual or group charge. And a real bonus and plus point, something to shout about really, is that there were 40,881 participants of total that went through the 21 by 21 campaign that completed the training, of which 25,493 were e-learning completions. In terms of our qualitative data, so from the interviews, it's kind of split into two parts with what I'm going to present. So the first one is looking at the perceptions of the role of the coach before they undertook the mental health training, and then the perceptions of the coach after they'd undertaken the mental health training, and then looking at the changes in confidence and competence within their role. Then we focus on mental health training in how it's viewed, or their perceptions of how it's viewed in comparison to physical first aid and safeguarding, and then some of the barriers that were in place in terms of taking the mental health training. So I thought it was really important to discover what the coach's own experiences and feelings were prior to taking the mental health training. And the coaches highlighted they were very, very passionate about supporting the participants by creating a safe and fun environment within their sessions, as well as presenting themselves as a positive role model. Many of the coaches that were interviewed explained how they strive to be caring and supportive. However, as you can see from the data that's in front of you, it was clear that the coaches often felt that their role in supporting their participants with their mental health was outside of their remit because they'd not been offered or undertaken training prior to this point. Despite this view, many of the coaches we interviewed felt that they had a key position of authority and trust involving high levels of responsibility and a duty of care towards their participants that they work with. And this is something that has also been found by other research. The coaches believe that the strong rapport that they were able to build up with the participants because of the relationship they had, although it was a position of authority, but a lot of them felt it wasn't too formal. They were seen as friends and role models, that the participants were able to trust them, and therefore, unlike maybe teachers, parents or guardians, they felt they were in a position that participants were likely to come to them more than others. The coaches reported that they lacked awareness and knowledge or training to support a participant's mental health. They didn't know or were unsure of what to say or do, other than adopting a basic, friendly and supportive approach. So as you can see there from the quotes, that was something that really shone through with all the participants that we interviewed from the study. However, once the course had been completed, the coaches all highlighted that supporting participants' mental health was a major characteristic or responsibility within their role. In this regard, the training reinforced the sense that they could be a key figure for mental health issues, and they should acquire sufficient knowledge around mental health awareness and support. Again, something that's been found elsewhere within research. The participants themselves described that after the training, they viewed their role in a position of power or authority, which could positively influence their participants' understanding of mental health, as well as encourage participants to seek help and support if required. The coaches further discussed how they could use their position to create a positive environment in order to further influence perceptions and understanding regarding mental health awareness. And, I think some of the points we've highlighted here within some of the data, that they knew it was their responsibility, and they felt confident to take that responsibility on, and were really able to start normalising conversations around mental health with their participants, which again encouraged their participants to come and speak to them. So as I've just said, it was clear based on what we found that mental health training had several benefits. A major benefit was increased confidence in helping someone who may be suffering from a mental health issue. Particular kind of confidence increased. Participants expressed how the mental health training provided them with a confidence to raise awareness of mental health, to discuss mental health with their participants and colleagues, and to create a really positive environment within their sessions and to normalise this discussion around mental health. The coaches stated that subsequently believed challenging and eradicating negative stigma was extremely important. The mental health training motivated them to educate others and attempt to reduce negative stigma. And I think we'll all be aware this is something that is a big issue within all levels of sport. It's starting to be discussed more, but removing that from the close environments within changing rooms, within sports clubs is a real key to make this more accessible to all and have people with confidence to come out and speak about it and also deal with it in terms of coaching perspective. So moving on to part 2 from the findings and how it compares, or how the perception of how it was viewed compared to physical first aid and safeguarding. And the participants within the study perceive mental health training to be similar or more important than physical first aid and safeguarding, both of which are mandatory within training qualifications for coaches. However, mental health training isn't mandatory at all. So they commented that they felt there was a prominence, that the prominence and prevalence of mental health training lagged behind the other components that make up musts within national governing body qualifications. And then they believed that mental health training should be given the same importance, if not more importance, as physical first aid and safeguarding. Some of the coaches suggested that making mental health training compulsory or integrating it into level 1 coaching qualification compulsory element was necessary. That was the view of participants. I think something we discussed within the group when we're looking at this is it not just for level 1, because obviously there's people that have been working and coaching for a long period of time, and anyone that's really working this should be encouraged to undertake this. I think that would have a significant benefit. There were also barriers highlighted by the participants within this study to mental health training, and the main two were time and financial cost. The major focus of the coaches in discussing the issue was the financial cost of making mental health training widely available, as well as the personal cost of undertaking the training. Financial costs, personal and to national and governing bodies, were thought to be one of the main reasons that the training was not currently well known or used regularly within a sporting environment. When personal financial costs were weighed against the benefits of the training, in some cases, the training was not considered to be worthwhile. The lack of funding to support mental health training was a source of frustration for the participants. Now, I know once the training got moved online, largely a lot of organisations did supply it free of charge, which was great. It did come through within the data as well, that the online training was felt to be very good, but they would have preferred to done it in person to have that interaction and have a greater understanding of how to interact with their own participants. Some concluding remarks. What we found, our research suggests that most coaches recognise the key role they have been working within young sports participants, but are unsure of their role in regards to mental health and how to support participants. We found that mental health training can help improve knowledge and confidence among coaches on issues related to mental health. This includes motivating coaches to provide better support, address stigma, and have more open discussions with their participants and colleagues. These findings sit along other work that suggests mental health training is an effective tool for improving mental health literacy in coaches and volunteers. And based on this, we've also made some reflections and recommendations. So we suggest and recommend that mental health training is a core activity for coaches, both paid and in the voluntary environment, alongside safeguarding and physical first aid. That funded courses continue and expand to ensure that cost isn't a barrier. Research is needed on the impact of mental health training on participants in terms of participation, retention, and experience. Mental health friendly organisational cultures need to be promoted so that responsibility is shared across organisations, including the senior management. And I think that's the thing that everybody needs to buy into it, to ensure that it's valued as how it should be valued. And I think that's something that can influence those wanting to take part in it and seeing it as a necessity rather than just a tick box exercise. I'm not going to go through the rest, but another thing that I think would be great, we would love to do enough time within this project, is to interview, as I've kind of highlighted within the recommendations, those that have been the participants of those that have gone on and undertaking the coaching to see what impact they felt and what benefit they felt it brought to those sessions. And that's everything. So the report should be out hopefully within the next couple of weeks. It's just been sent off to the designer to promote, but I'm happy to take any questions from there. I'll stop sharing my screen if I can.
Great, Graeme. That's very, very interesting, and certainly the quantitative and qualitative pieces to the story give us more insight. Can you talk a little bit more about, I mean, the mental health training itself? What are the key ingredients in that training?
It's you know, it depends what training you've undertaken. So obviously varies between the online and the face-to-face, but largely getting coaches or those on it to reflect on their own experiences and then talk about situations that they may encounter and give them pointers to deal with that, handle that. So it's like largely building that confidence and creating a greater understanding around mental health to reduce that stigma and making themselves feel more comfortable, and then hopefully in turn the participants within those sessions feel more comfortable. Yeah.
And I guess is part of it where to refer if there's young people with particular challenges?
Yeah, absolutely. Part of it is not to make them feel that they're the sole responsibility then for that individual, to make sure they are aware of where to refer these people onto. And yeah, like I say, because we don't want people that aren't trained in it trying to then deal with it. It's having the confidence to have that conversation, open the doorway if you like, and then point them in the right direction from there.
Yeah. That's great. Any other questions for Graeme? Looking at the chat box and multitasking here.
Nothing in the chat box that I've seen.
So. Okay, all right, thanks. So I'm sure at the end we'll have a collective discussion, because I mean, it's interesting at the point about when you can, my heavens, it is nice to be having people around the table to talk about these issues. Online, I think hybrid may be the way we go in the future, but you need human beings looking at each other in the eye and talking and exchanging good practice, questionable practice, understanding, etc. Okay, our next speaker is, I'm sure, known to many of you. That's Professor Andy Smith from Edge Hill University. His research focuses on mental health and suicide prevention in children and young people in the schools, local communities, as well as in professional sport. And Andy contributed to the government's independent duty of care in sport review, a very important review. And he's led the UK's first research project into mental health in the sport and physical activity workforce. And he's currently collaborating with colleagues at Loughborough and Sport for Development Coalition in mind to review the evidence and provide policy recommendations on what sport and physical activity can do to make this world a better place. So welcome, Andy. We look forward to your presentation.
Thanks, Joan, and yeah, good morning, or just before the afternoon to all the colleagues who are on the call, and thanks also to the two previous presenters who've addressed some of the issues, which I'm sure we'll come back to both in this presentation and later on. I'm being asked to talk very briefly about a project that we've been doing now since 2015 in conjunction with colleagues at the official charity of Everton Football Club, Everton in the community, and then from September of last year we added an additional partner, the Tate and Tate Liverpool, to help us to begin to address a whole range of other additional mental health challenges in children and young people, as I'll explain as we go through. Just very briefly, I think, as we know, the mental health of children and young people has been of concern for a while, not just because of COVID. And I think that's one key thing that is always important to remember, that this was an issue that we needed rightfully to be concerned about pre-COVID, and there was concern that mental health in children and young people was deteriorating for a while prior to COVID, and we shouldn't forget that. Although some of the evidence is more challenging, there's a general lack of data, systematic data on at the national level on population mental health among children and young people. The latest research that we have suggests that there's been a slight increase in probable mental health disorders across all age groups, among those under the age of 25 and including those under the age of 18. And not surprisingly, like in health more widely, this has been closely connected to existing inequalities in young people's lives. And those inequalities have been made clear in lots of ways by lots of other people before today, has been amplified, worsened, and widened by COVID. And that's particularly clear in some of the low income racialised communities where lots of projects run by StreetGames, for example, operate. And that's also true in the areas where we deliver our particular programme. Before I go on to describe what the programme involves and some of the key elements of that, one of the longitudinal systematic studies that have tried to track the impact, for example, that COVID has had on the mental health of children and young people is the CoSpace study delivered by colleagues at Oxford. And as you can see on the screen before us, the impact of the lockdown, but also the associated restrictions, and I think that's important to bear in mind, has clearly had an impact on the mental health of children and young people. So if you look into the first lockdown, both retentional, emotional and behavioural challenges, they all increased quite notably during the first lockdown. That came in March 2020 and began to decline again before the first series of local restrictions were implemented. And as successive lockdowns have been introduced, the general trajectory has been upwards. So it's clear that the consistent series of lockdowns and local restrictions have had some quite profound impact on young people generally, but they've had particular impacts on young people who are living in quite vulnerable circumstances in low-income communities, typically with single-parent families, often headed by women, and also some of the families which live in racialised communities have also been disproportionately affected by the impacts of COVID, and that continues to be so, not just in the immediate term, but the concern, of course, is what is this going to mean for the long-term mental health of both of children and young people generally, but in particular communities. So the Tackling the Blues programme is a mental health literacy programme that is conducted in schools and local communities. When we first started out in 2015, the primary focus was on sport and physical activity, and I should emphasise at the beginning that this is not about trying to enable children and young people to become excellent footballers, netballers, hockey players, or what have you. It was very much an opportunity where we could get children and young people to engage in multi-activity, multi-sport programs that they themselves choose. So we don't impose particular sports or activities on them. It's very much done from the perspective of co-development and co-design. And we often, at the beginning of these programs, ask the children and young people what types of activities that they want to engage in, and we provide that as a curriculum across the whole school year, as I'll come on to. And then, as I mentioned earlier, out of recognition that for some young people, even multi-activity, multi-sport programs were not particularly conducive to fostering the types of autonomous climates that Joan mentioned right at the beginning of this session. So through some consultation with the children and young people that were participating in the programme, we added an art and creative strand, which includes more traditional arts, but also music and other elements of culture. And the young people who take part in the programme now benefit from engaging in those activities as well. The project supports children and young people aged 6 to 16 who are experiencing or at risk of developing mental illness. By experiencing, we mean they've received a clinical diagnosis from a relevant mental health professional or medical professional, and by at risk of developing, what we're generally looking at there are some of the ways in which the young people who are involved in the programme have been identified as having particularly poor mental health, but have yet to receive a diagnosis for a range of reasons, most usually because they haven't been able to enter the CAMS service, or the Child and Adolescent Mental Health Services that they require to receive the types of support that they need. In addition to those, they've been identified by schools and other local community organisations as having particular risk factors that have compromised mental health over the course of their lives up to now. So it's delivered in conjunction, as I said, with colleagues at Everton and Tate Liverpool, and it's delivered in very low income, highly deprived communities where schools are located throughout Merseyside and West Lancashire in northwest England. Some of those communities are in the top 10% most deprived communities in the country. Some of them are actually in the top 1% of those. And for some of those young people who take part, we actively engage them in local schools or through other local community groups. Where it's delivered in schools, it depends very much on the school priorities. So for some, these sessions are actually delivered during curriculum time. For some, it's after school, but most usually it's in school at the request of the school, and it's delivered really to support existing infrastructure within schools. So what we're not trying to do is to go in, take over, and then leave after a couple of hours each week. But we're essentially embedded within the schools as part of a whole school approach to mental health and well-being, and that's really important because although we're working with children and young people, usually for a couple of hours each week, we also work with the schools, the head teachers, the senior leaders and others to disseminate learning from the time that we have with the children and young people across the school and into staff development, CPD, into the development of other activities that the schools deliver when we're not there. And that's been a consistent feature of what we're trying to do here, is to share that decision making, but ensuring also always that the voices and needs, experiences of children and young people are used to set the types of activities and curricula that are developed within schools to ensure that they're most relevant to their needs and that they meet the various needs of their local communities. Because as many of the projects that StreetGames and other colleagues are involved in, the mental health needs of children and young people do vary quite substantially. We work in 3 schools, for example, within 2 miles of each other, and the way that the programme is delivered in each school is quite different because the needs of the young people in each of the schools vary quite substantially. So in one school, there's a particularly prominent problem related to anxiety, depression and self-harm among young people. In the school down the road, there's a real concern around challenging behaviour linked to gang culture, knife and drug crime, and the ways in which that manifests both in relation to low self-esteem, depression, but also in relation to suicide attempts, unfortunately. And in the third, there's also a particular problem related to eating behaviours and the ways in which that begins to impact on the lives of the children and young people who attend schools and local community services there. So it's very much a place-based and space-based approach to health and well-being. And the programme is delivered weekly through 2 principal methods or mechanisms, really. We have activity-based sessions, which are delivered, as I mentioned earlier, on a multi-activity, multi-skills approach. And all of the activities that we do there are linked to a mental health theme. So the emphasis is not on being good at sport, but it's actually about how you can develop mental health literacy through the activities that are being delivered. So, for example, we may have a session focused on trust, confidentiality, positive, productive relationships, communication, it might also be about the control or expression of emotion in and through those sporting activities. And then that's also then followed up in supplementary education workshops, which in some cases include some of the art and creative industries that we referred to previously, but it also follows through some of the activity session learning that we developed in more practical situations. They're delivered, as you'll see on the next slide, by a series of trained peer mentors. And we have two groups of mentors, both lead and support, and they're leading the sessions in the schools with us based on the key themes that I'll go on to mention. Before I show you the particular mentor model, what I thought I'd just kind of give you a brief sense of here is actually how we deliver these things. And on the screen, as you can see there, we have a series of program outcomes, how we deliver them, and then the planning that goes into the sessions at the bottom. And then the immediate right side, you'll see there the types of themes that we address in some of the workshops and the activities. So some of the themes will include things like bullying, communication, feelings and emotions, nutrition, physical well-being and how that impacts on mental well-being, positive and productive relationships, resilience, stress coping, teamwork, and so on. And that's all delivered through both the workshops and the activity that we talked about, but it's underpinned by a peer mentoring model which really focuses on the emotional intelligence, problem solving, communication, and so on, that children and young people need to become mentally healthy and literate in a mental health sense. And we do that in relation to the key known risk factors for mental health, both through Public Health England, but also the substantial academic research which exists in this particular area. One of the most important features for us is that we have trained peer mentors. The mentors are two broad types of groups. We have at the top here a series of trained project coordinators. They're trained through things like mental health first aid, suicide intervention, youth work and social work activities, as well as a lot of CAMS related professional development. And they help to coordinate our mentors, who are recruited from both our postgraduate and undergraduate student body. To take part in the project, the students, of course, have to actively apply through the usual means by application and interview to take part. They commit to a series of mental health training, which includes MHFA that Graeme referred to earlier, as well as other mental health training. And they work with us really to underpin the programme by the kind of 5 ways to wellbeing model, and how that's used then to help deliver the session. This has been really important because one of the key feedback from the young people who the programme is there to support are really important in the sense that the children and young people feel comfortable talking to the peer mentors. They're deemed to be closer to them, both in terms of age, areas of interest, but also they're able to share their own experiences with the mentors rather than with other significant others, which may include teachers, parents, and older adults. So that's been really important for us, and that's how we can typically deliver those sessions. We're also mindful, of course, that the evidence which underpins this needs to be shaped by known risk factors for mental health and well-being, and many of those can be outside the control of any individual programme like this, and we need to ensure that we're addressing some of those and the determinants of mental health in and through the programme. So at the top in the kind of pink boxes, these are some of the known risk factors for poor mental health and well-being, and we try to address some of those in the key themes of the workshops and the activities that I've referred to previously, to ensure that we really are addressing the key risk factors and some of what are called the adverse childhood experiences which are typically and disproportionately found among those in more insecure, low income and underserved communities. And then in the green box, we also see some of the protective factors, or some of the things which are known by the evidence base to help support young people to improve their mental health and well-being. So it really is quite comprehensive in that sense, and each of the sessions are informed by that, so that when we move on, there's the whole series of impacts that we've looked at here, both from the young people's perspective. So we actively engage them in research, whether it's through peer interviews, whether it's through formal focus groups or interviews led by the coordinators or the project staff. And we also have other kind of mental wellbeing scales, which may include WEMWEBs, as well as more quality of life measures like KidScreen we've used in the past. And generally what we see here are kind of improvements in things like self-esteem, autonomy, supportive relationships and so on, reductions in anxiety, depression and self-harm, intentions and actions. And we also try to get a sense of how the programme is delivered and how that corresponds to the preferred experiences, needs and wants of the young people. And that's really about developing the types of climates that Joan referred to earlier. So I won't go through those in lots of detail. I was asked to talk mainly around some of the types of the activities that we do provide. I'll leave it there because I'm conscious that we want to kind of finish as close as we can to 15 minutes. So thanks very much for listening. If you are interested in any of that, then please do drop me an email using the details there, or contact us via Twitter. In terms of the scale of this, it's been quite substantial up to now. We've engaged just over 1,000 young people from 25 schools, and we're due to increase that next year with the support of some additional funding, and start looking at cluster-based approaches to community wellbeing rather than just focusing on individual schools, which is what we've done up to now. So Joan, Dawn, I think I'll stop there and then.
Okay, cheers, Andy. Yeah, very, very impressive and extensive in terms of what you've been doing. And just checking the chat box if there's any questions. Maybe I'll throw one. Okay, our local minds, Lucy's asking, are local minds engaged with this delivery, Andy?
Yeah, in some cases, yes, but unfortunately in Liverpool, there isn't actually a local mind, which is one of the big challenges actually that we found. And one of the reasons why we were encouraged to develop the programme in the first place was general absence of mental health support for children and young people in the area. So that was really kind of the motivation for starting. But what we're doing now is certainly where local minds exist and where local CAM services exist, we do integrate those into the school. So it's very much a community-centred approach to the programme now. So we are linking schools into other services locally, particularly in the communities where we operate. So yeah, it's really important that it's embedded into the existing community services rather than us going in, delivering for an hour and then go home. It's firmly embedded within the local communities. And I think that the one point around the student training, and I think it's relevant also for the comments earlier around coaches, is that it's important that we safeguard the mental health and well-being of the people who are helping us to deliver the programme. And some of the students, of course, who are attracted to this programme have themselves experienced poor mental health and well-being. So an important part of that is actually about how we support the mental health of the peer leaders and peer mentors. So that's an added part of what we're doing actually, and how we support them, and how engagement in the programme can support their own mental health and well-being, which is really important. I think that's true also for coaches.
Yeah,
a lot of expectation on coaches, and we have to also remember that they are people too, and we have to support them where needed.
Yeah, I think that's been a very good thing, that the mental health of coaches has now come on you know, on the table in terms of discussion and what we can do about it. I mean, it's hard to deliver a mentally healthy sporting offering if you yourself are struggling with some issues. Thanks very much for that, Andy. I'm trying to control my dog right now, who hears the mail post person just came. Multitasking. Okay, we now turn to Craig Robson, who's a public health practitioner from Durham County Council. Craig has worn a lot of different hats, going to bring a great wealth of experience to this discussion. He's worked in local authorities, voluntary education, and now public health. He has experience of project design, management, intervention to support people to improve their health and well-being. And he's also, again, with the football theme, looks like you had a chance to go to Brazil when they had the World Cup and then the Olympics and do some great work down there. So it's always interesting. We do a bit of international work too when you try to work with colleagues in different countries and integrate and implement programs. So Craig, the floor is yours. We very much look forward to your presentation.
Thank you very much. So yeah, I have a bit of a different background. The work I'm going to kind of talk about is related to the further education setting, but it also links to community as well. So although I'm in public health now, my previous role was a sport development manager. So very much linked to the sport and physical activity sector. Dawn's kindly going to do my slides because technology lets us down. I'm going to skip over research because I'm not a doctor, I'm not a professor, so I'm going to leave that to Andy, Graeme and Joan. I'm kind of going to put it in the context of how do you put this into practice and maybe any learning that I have from that. So if we can go to the next slide, Dawn, please. The research that's here is on the StreetGames website. If you are really interested, you can look at it that way, or I'm sure if you contact Dawn will be more than happy to take you through it. I will mention, obviously there's links to the 21 by 21 campaign, which Graeme spoke about, Safe, Fit and Well, and also social prescribing, which I'll discuss in a bit more detail. If I can go to the next slide, Dawn. Again, this kind of breaks the research down into a bit more around social prescribing. As I've said, I'm not going to go into it. I'm just going to kind of talk about how you can use this research to put it into practice in your setting. And then the next slide as well, please, Dawn. So I was really conscious that I didn't want to be like, this is what we've got. If it's good or not, this is how it works. I wanted to kind of show the process because I think this adds a bit more background into it. So this has been kind of a 4-year long, so my time at college, it was a development stage. So I used to approach every year, look at it, assess it, reflect on practice, and also around my staff as well. So joining the college, we were sporting and funded. So our main area was getting inactive students and also a bit of community members physically active through multiple sports. And this is where we introduced Safe, Fit and Well. Safe, Fit and Well was a referral program. So learners that had low mood or anxiety or stress could get referred into me and my team, and we would do something that changed the mindset. So whether that was sport as in a team sport or an individual sport, or whether that was a fitness or gym-based program. As things developed, we had an offer which staff knew about that they were happy to refer in. Me and my staff team did the 2-day mental health first aid course. And then we started kind of working with course areas to educate them about mental health. Growing up and when I was at school, no one really ever taught you about mental health. So what we found is that if we could introduce an awareness session, it actually led to more referrals into Safe, Fit and Well programs, because just talking about it kind of opened up that conversation for students. 2019, we were unsuccessful, so this was a consulting approach around how could we utilize social prescribing for children and young people. And it was the local authority, it was an education site, StreetGames, and then also a voluntary sector organisation about how do we get young people who are struggling into community sites from an education. It was knocked back, but those partnerships were built up slowly. And this is where I kind of started using my public health knowledge and kind of upskilling my own staff. So I knew it was no good putting staff on a program if they didn't feel comfortable doing it. And it wasn't purely just mental health. It was about how can we link into the public health messages around obesity or around smoking or alcohol, because the age setting we are with was probably where risk-taking behaviours would maybe increase around that 16 to 19. So it's really important to kind of consider that. And last year, as everyone will be aware, COVID, we had big plans, everything went remote, but it didn't kind of stop where I wanted to go with it. So we revamped the offer around training. So it wasn't just a mental health awareness session. We started delivering aspects around smoking awareness, drugs and alcohol awareness, physical activity, increasing the number of sessions that we could deliver safely. We utilised free training. So I put myself and the staff team on the resilience training, which was with Bloom and Mental Health UK. So we could kind of look at a prevention agenda. So those that maybe were not anxious or were not struggling or depressed, but how could we build in coping skills and resilience to what this offer would be. We also had smoking advisors. So again, this was training through the public health team. It's interesting working with college students. So there is some strange thoughts or what they read on Facebook, they assume is gospel if they've read it on Lad Bible, and they assume they can lose weight by just going in the bath. So smoking, actually, they thought that was reducing stress. And what we found is that those that were referred into our Safe Fit and Well program generally were taking up smoking or coming to college and through that peer aspect, taking up smoking, which actually wasn't benefiting the mental health. And we finally got, a couple of years later, a youth social prescribing offer. So that was put in place. Again, it was in partnership with First Contact Clinical. It's been remote, it's now face-to-face. But again, it was just trying to look at what we could do to kind of support. So that's kind of the process, and this is how each individual aspect will go in. So if I can go to the next slide, please, Dawn. Essentially, my advice is assess what the need is. So for me, it was we had a gap. We had a counsellor, but not every young person wanted to speak to a counsellor, go into that setting. And we had a sport and physical activity offer, which was Safe, Fit and Well. Not every learner wanted to go to the gym or play sports to improve their mental health. So knowing there was that gap, that's why I was really keen to include a social prescribing offer, because it just gave a young person somewhere to talk to, not a counsellor, and they could just talk about things that they could do on site that in the community might help. So whether that was volunteering or whether that was art, design, whatever they were interested in, they had something in place. Like everyone on the call, you just want to do your best. And that's something that I stress to my team, is that we're not going to solve mental health. We're not going to reduce or prevent mental health. It's just doing our best and putting in processes and plans and that development aspect so that my staff were confident in what they were doing, that young people had confidence that they weren't just going to go on another waiting list. It wasn't going to be something that doesn't work for them. Also, I guess it's linking into your local area and what is the local priorities. So that was looking at the council strategic plans, what the mental health strategy was in our area, what the CCG priorities were going to be, especially around young people, because otherwise we'd just be operating in one silo on a college site, and when our learners leave, actually, like, what happens to them then? It's like not just stabbing around in the dark or stumbling around. We actually surveyed. So what I've learned now in public health is that, again, referrals from staff, it would go to our counsellor, but there was no kind of evidence base around that. So what we did is we utilised a kind of a traffic light system, so that when learners were coming into the college, they would do a wellbeing survey, which was the Warwick Environmental Wellbeing. We asked a question about physical activity and about sleep. Using that, we kind of had some sort of evidence that we could go off, so that when I talked about the tutorials about alcohol or the sleep awareness workshop, actually I could filter it per curriculum area and target those areas. So if people were scoring low on the mental health survey, and it was from health and social care, then actually we may put a mental health awareness workshop into that curriculum area and talk about what support there is available, just to kind of make sure that we weren't going in and just offering alcohol awareness or sleep awareness, like a scattered approach. Time is really important, and I think everyone will find that. So if we could do it better, then it made sense to do that. So assessing need, I would stress it in your setting is really important, in tools from a public health point of view. There is a lot out there, but this is what the research is kind of for. Next slide, please, Dawn. This is how the offer works. I'm conscious of time, but this is just a snapshot. So a student coming to college, they have their course. The green boxes here, this is what we offered. So we had an enrichment offer, and this kind of links into your Ofsted requirements. So what's your intent? How are you implementing it? And then what's the impact of what you're doing? So the social prescribing, the safe fit and well, the smoking cessation had a massive impact on retaining learners, but also having learners come in. So we did a lot around those that are not in education or weren't in training. Having the support system in place actually led to young people coming to the college, because they maybe, from our community work, they would get the nose, and actually there was a bit of an internal support system available to them. The one thing I will note about this is obviously the counsellor could refer to a smoking service or the safe fit and well. It worked both ways. So as a model, it was more of a circle as opposed to a drop down arrow. Next slide, please, Dawn. These are some of the reasons for referral. Again, I'm really conscious that I wouldn't ask staff or the teaching staff at my college just to refer in, because then that creates a backlog, or that can be the wrong referral. So working with First Contact, they had a flow chart, which a member of staff could look at quite simply and assess the need. They didn't have to have a mental health first aid qualification to do this. It just broke it down as in actually what is social prescribing. It can be called a lot of things. Prescribing maybe isn't always the best word for it. It sounds a bit medical, but actually it just stopped people getting put into something that maybe wouldn't work for them. And as you'll see, these are some of the comments taken from the referral form. Wasting time, no positives. Again, it just sounds quite negative, so we needed to make it, instead of negative, turn it to a bit more positive. Next slide, please, Dawn. So this is actually putting it in action. So it's all well and good as talking about it and presenting this and telling governors or telling senior leaders about it. Actually, what's the difference? What difference does it make to SAM and health and social care? What's the impact of what we do? And I was really fortunate that I had a really good team who are passionate about what they do. So despite the pandemic, we got social prescribing in place. Within a month, we had 17 referrals from education staff. We'd had a training session, so staff got to meet Liam, our link worker, talk through it. What does it? How do you refer in? What do you do? And that network approach of there's that support that's available. So if someone's unsure, they can always ask. Learners are kind of targeted personal, social, and emotional. So those that weren't talking to the counsellor, this kind of covered that early stages of something's maybe not right. I'm not sure why, or falling out with a friend. This kind of picked up that, and it kind of saved our counsellor dealing with 1,000 learners a week or whatever a waiting list came to. Safe Fit and Well, initially it started slow, but it rocketed. So that was 41 referrals, I think, in about 3 months. Not all of them were attending the gym, but we tried to combine some of the lessons from lockdown. So utilising local Strava routes, providing home workouts, just so there wasn't that pressure for them to come into a facility. The gym isn't for everybody. Like, sometimes there's concerns or there's a lack of confidence around that. So the program needed to adapt to that. And ultimately it was confidential. We didn't highlight Sam is on this program. It wasn't advertised massively. And also learners kind of built that trust, and that's where the learning comes in from your youth mental health first aid. It's about that trust and understanding what to do with the information you've got. Next slide, please, Dawn. These are some of the outcomes. It improved the physical health. So learners who wouldn't go to Safe Fit and Well did social prescribing, and then they thought, actually, I want to do this program. I want to take part in sport. I want to be physically active because I think it'll help us. From an education point of view, and this could be across anything, but setting goals and targets, building that confidence to do it, it links to your personal development, And I guess what Andy was saying about your adverse childhood experiences, just because you're in an area of deprivation doesn't mean you don't want to achieve. And I think it was really important that we provided that space at the college. If they weren't academically performing, actually, could we just help them improve something physically, or could we socially help them make friends? Again, that prevention, recognizing triggers, and also signposting learners. They were in college, maybe 1 hour, 2 hours a day. That's not gonna cater for the entire day. So building that community link was really important, because actually they could get referred into the local stables to take a horse riding, or there was free activity sessions out in the community that they could access. We had to have those links. And when I kind of trying to highlight the need, obviously the other side is what's the impact. So from a social investment point of view, it was able to work that out using the Housing Association's tool or calculator. By doing what we've done, the social value of that was £27,000 for those learners. And that's kind of on other services, so whether that's healthcare or the criminal justice system. Just by having this Safe Fit and Well program, this is the value of what we're doing. And then also from a college point of view, it's retaining learners. So me evidencing this about what my staff are doing was really important. And then I think it's the next slide, that might be the last one. I'm going to mention public health, because obviously they've enabled us to come and do this today. At the moment, I'm really, County Durham has been great. Linking into what Graeme spoke about, by March 2022, there's a program I'm looking at the minute with the team, which will have 1,000 youth mental health first aiders qualified. That's going to be in youth settings, that's going to be in school settings. Essentially, every setting that we target should have at least one qualified youth mental health first aider through mental health first aid. A framework as well, so encouraging education settings to think about well-being and how that impacts on their setting and what they can do for staff, families and children. Again, it's all new, so I'm just kind of looking into it a little bit, but also resources. So they've got some great rainbow resources on the screen, which kind of cover, if you need support locally or nationally, how do you access it, and quick provision, so it should be readily available. Then I think the next one is the final slide. My advice, so my email's on there. Again, it's just really a whirlwind about 4 years in the new role, but like I didn't just start this and it was a success. We got knocked back for stuff, things didn't work, referrals was wrong. I guess what I'm trying to say is that it's all part of your learning process. So if you understand your local area, generally your contacts build up that way. And this is where some conversations led to. So that's how social prescribing came about. The relationships, that's internal and external, so that's with the young people, that's with national governing bodies of sports, or other aspects of I guess your local industry, so local authority. Make use of free training and resources. So at the minute I'm doing a level 2 understanding childhood, adverse childhood experiences, just to build up my knowledge around that. I think from what I'm looking at strategically, that's going to be an important thing when I look at education sites. And also linking locally. There is the national network, but just find out like what's going on. And I think those conversations, that's how I went to Brazil. It was a conversation. And then I found myself over there for a spell, trying to learn Portuguese. So a lot of it is just talking to people. So I'm happy to kind of advise. I appreciate time. Might be some questions, but yeah, I think just have a go and don't feel pressure to do the right thing. Mistakes will happen, and that's me done now.
Oh, that's great, Craig. Really, really interesting and very timely and apt advice at the end. We do have a little bit more time. I think then technically was put on the program. Looking for any particular questions. If not, let me just I'll throw one out to my colleagues here and get your views. This has even raised more in my consciousness in terms of enablers and facilitators and barriers in terms of the work we're trying to do with leveling the playing field. That's addressing racial and ethnic minorities. And I think it was Chris, I'm not sure, a little bit further up in the chat, mentioned that. How is this being addressed in these various programs, or, you know, to the extent that it is, in terms of the people delivering the programs, in terms of ethnic, racial diversity, as well as the people we're trying to target with these programs? And so, say, Graeme, do you want to kick off in terms of the work so far you've done?
Yeah, from 21 by 21 campaign, obviously it was largely targeting community coaches and volunteers. So it was going for areas away from elite sport, which I think isn't often focused enough. Then in terms of ethnic minorities, it was something we were wanting to look at, but unfortunately we couldn't get into that area because of COVID, restricted our access to certain locations. But as we know, it's certainly something that needs approaching, certainly something that needs looking at, and to get more people from ethnic minority backgrounds into participating in sport, and then also coaching, working with sports. You know, I think elite sports are a great reflection of how far away we are from where we need to be.
Yeah.
So yeah, I don't have too much to offer, unfortunately, from the research that we've done, but that's my view on it.
Yeah. So there's, I mean, and that example is, I think, not too unusual that you're doing that work, and basically it's still primarily we're studying or trying to make change among a primarily white British world, which is certainly not the face of this country. How about you, Andy? What in terms of so far the work you've been doing up Liverpool way?
Yeah, it's a good point, Chris. And wherever possible, we do recruit from the student body who obviously wants to take part, and we try to be deliberately inclusive. And what's really important for us, I think, when we're allocating the mentors, and obviously speaking with the mentors where they work, it's quite a diverse area of the Northwest, even within Liverpool or within Lancashire, they're quite diverse communities. So what's been really helpful for us, I think, is matching students to the communities from which they originally derived. So in some cases, they've been to the school themselves. But if that's not possible, we certainly try and match them to the communities where they're already delivering. That seems to go well with the students, the pupils in the schools and in the communities, and community leaders, because they're often trusted individuals. They know the trusted organisations locally, and that's really important. I mean, I think that one of the challenges that we face in terms of further diversifying the delivery of the program is actually the composition of the students who attend the university, because reflecting a lot of the local communities, actually, we're still primarily white in parts of the Northwest, and in parts it's still dominated by males, sometimes it's by females, and that's been a real concern for us, where we've had students who may commute from further afield, and we're getting more of those. But I think, you know, with fees and everything else, like lots of us are seeing a lot of regionalisation or localism. That does that is one of the kind of challenges that we face, and you know, the barrier for us there is if we're trying to put in people who are from local communities with their local communities, that's great, but what do we do with the other students? We've got to support them and to try to embrace cultural diversity across the programs and in the sessions. And that has been, to a degree, a challenge. What we've also tried to do, though, obviously through COVID, is actually deliver a lot of these sessions online. So we've developed some kind of bite-sized sessions with schools. And one of the key things we've looked at is diversity among the student body and among the activities. I think that's the other thing, actually, that we've really tried to work on, because there is a lot of unconscious bias here. You know, we can just focus on delivering, you know, British sport, we'll just focus on football, or we'll just do this and we just do that. And actually, you know, for a lot of people, regardless of whether that is their preferred types of activities, we're not really doing those students any favours. We're not trying to broaden their cultural horizons either. So we try to embed it in that activity if we can't necessarily do it from a personnel perspective. But it's a real challenge, you know, in that part of the Northwest. If you go bit further afield, you know, you do find yourself in more culturally diverse and ethnically diverse communities, and I think that's what we need to be mindful of. But yeah, we kind of hamstrung a bit by who comes through the door. The accents are really important. So the likes of me, they don't let me anywhere near Liverpool, because I remember doing that once, and the students thought I was a police officer, and they wouldn't let me even to school. Yeah, the students don't let me get anywhere near there either. And to be fair,
sorry, could you just say that last point again? I didn't quite understand.
Oh, yeah, I thought that might be the case. I'm surprised actually that Joan and Dawn didn't ask for subtitles on my thing. Perhaps I'm trying to be inclusive and culturally accepting. But thanks for that stigmatizing remark, Chris. I'll shut up.
Yeah, maybe I'm the one that needs the subtitles, because I have that kind of
no.
on the other side of the Atlantic. Well, I mean, just a comment there. I mean, I think this is one point about delivery and embedding and who's receiving our programs. But then if we, you know, this has been coming through in all the presentations about looking at effect on mentors, coaches, and then trying to evaluate in some sound, meaningful way impact. And so now you have this whole challenge as well, to be bringing research instruments and, you know, getting access in terms of focus groups and what have you, with ethnically, racially diverse populations, and trying to break down those barriers. So we find out, I mean, I came through all the talks about how we need to be having this co-developed, co-delivery, co-embedded right from the get-go, and have that evolve. And you know, if who's around the table is limited for whatever reason, even logistically limited, we just don't know whether our programs work or how to have them optimized within these particular communities. And Craig, in terms of your work, in terms of racial and ethnic diversity, how have you been able to what degree?
I mean, like
challenge?
Probably similar. So we're in the northeast of England. Essentially, it's probably 1% or a couple of percent either way from those communities. We did have a really good program, so we partnered with the Asylum Seekers and Refugees charity. There was like a Syrian resettlement scheme that came into the council, and it was handy having a female instructor. So we'd have Hannah, and we'd close the gym. So basically, kind of taking that cultural sensitivity around it, we offered a women's only gym session. So the gym was totally closed, female instructor, 2 to 4 p.m. And we were starting to get females who were studying ESOL classes at the college, and kind of tailored it around childcare, and trying to be sensitive around those. So yeah, we saw some success. It might have only been 6 people, but it's 6 people doing something that previously weren't able to go to our local gyms. And again, it was just making sure that it's inclusive. So when anyone came, a community member or a college student, there was an offer that's there for them, and it was just trying to be tailored towards it. Yeah. Ultimately, we have to have a project outline. This is how it will work, and this is a bit of a timeline. But I think just that little bit of flexibility is in where we could. If a male student wanted a male instructor, then we do it, and that's me delivering it. Then instead of Michael, it was kind of just trying to tailor a bit of personality around it. But yeah, I mean, it is a very small percentage, I have to say. But yeah, we just reached out and tried to do something to make a difference that way.
That's great. I mean, we certainly raised a number of enablers and facilitators, and I think good practice in this session, but also challenges. Yeah, you know, that we need to keep tackling and scratching our head. And I do think this bringing some of these efforts together and seeing how we can move forward with packages of delivery that can make a difference is another approach. I got the message here to cut. So with that, thank very much to Andy, Graeme, and Craig. It's been lovely sharing this session with you, and for those that have tuned in. And we might as well add Chris to our group, because he was right there with us all the way, posing questions and so on. So thanks very much. Hope you enjoy the rest of the day and have a good weekend. Cheers.